Hello, and welcome to tonight's session. Please say hi in the chat box and let us know where you're from. So, as for me, I'm Kai, live here from Cebu. Let me introduce myself. So, I am Kai Lo, the resident health systems specialist of MedEase. I have more than a decade of experience in sales, primarily in the pharmaceutical sector. With that, I have gained valuable insights into the world of healthcare industry. I have also worked briefly with RDB, that's a sustainable marketing agency, from which I discovered that aside from gaining profit from a business, we also need to have a purpose. All throughout my professional career, I have seen the power how medical interventions like consultations, laboratory operations can improve our quality of life. So with NetEase, I like to help in that cause by opening opportunities for physicians to optimize their day-to-day operations through integrating innovative technology, such as the product that we have in MedEase, to ensure that our patients get the quality healthcare services they deserve. So hello again, I'm Kai, and I believe that I currently am starting a new venture to provide innovative technology to healthcare. There, so just a disclaimer, I am not a doctor. This discussion may also contain promotional content. So aside from introducing myself, I'd like to introduce our company as well. MedEase is the medical system arm of MYT SoftDev Solutions, focusing on electronic medical records and diagnostic system. It is the integrated platform enabling easy patient management, communication, and updating patient records. We have two products, namely EMR Plus and Diagnosis. EMR Plus is the one that manages overall consultation process, and then Diagnosis, it's the seamless registration from laboratory procedures. So MedEase has been recently operating, but MYT is a Filipino-owned private software company reaching global clients such as Indonesia, Philippines, Singapore, UK, and has partners with more than 50 plus companies and counting. So MedEase is your local partner with international reach. Our topic for tonight is entitled PMR versus EMR, which is better. So if you missed our two other episodes, please do email us so we can send you a recording of that webinar. A more efficient tool in documentation record keeping in the clinic. We have two options, PMR or EMR. So let's look at the pros and cons of both options. These are our targets to tackle the topics to tackle this evening. So what PMRs are still widely used? What is EMR and do you really need it? Lastly, what is EMR Plus and how it differs from other brands of EMRs today? So basically, I assure you that at the end of the session, you will know the basics of EMR so that it will help you decide whether EMR is for you. And if you have burning questions outside of the topics that we will be discussing, feel free to ask them. You may chat them in the chat box or contact me in this channel. Okay, now let us start. So as we know, technology is fast evolving. Every so often, we see advancements in the different fields of medical science, such as robotics in rehab and 3D printing in creating implants and surgery, and so much more technology right now. However, according to the WHO Regional Office for Western Pacific, health recording remains to be manual in developing countries like the Philippines. Paper medical records, or PMR, is still widely used, and it's still the standard tool of documentation for the Philippines. So why is this so? It has been used for over a century and widely used until now. PMRs are affordable to start. You just need a pen and paper, and then you can start your consultation. It is also a familiar format, and somehow a convenient routine that makes it easy and at the same time easy to customize as well. These mainly are the benefits why doctors still continue to use them. At the same time, reasons also include, based from the discussions in the medical societies, there is a lack of technological infrastructure in the Philippines, the high cost to transition to digital, at the same time, a low support from the government like first world countries, and simply put, majority of our doctors do not know the presence of new technology and does not know where to acquire them. So that's the reason why PMRs is still the number one used or the widely used patient reporting in the Philippines. Indeed, PMRs are reliable. They are affordable. They are easy to customize. However, in reality, PMRs are time consuming. This is the experience I've encountered when having to talk to medical secretaries. PMRs are time consuming, especially for return patients in looking for the past medical history. PMRs are also risk for errors to patients. It is prone to human error as our medical secretaries do not always remember everything. It is also prone to mice infestation and others. There is no backup for PMRs. Once records are lost, then they cannot be recovered. This is a true story. One of my visits in the field, I have encountered a clinic where there was a mice infestation. It doesn't just lose the patient records, but also results in the bad smell in the clinic. So can you think of other uncontrollable phenomena that can affect negatively to our patients and the patient records, such as flood, fire, for example? Once they are infested, once they are wet, or even lost by fire, there's no backup anymore, and the patient records are lost. Also, it is not scalable. It is just limited to the space of your cabinet, and you don't have enough space to store a lot of your records, so it's not scalable. Overall, these risks may have been managed, but when they pose a risk for decreased quality of care to patients and efficiency of physicians, that may result to unwanted long-term impact to your practice. That is something we don't want to happen. So clearly, there is an opportunity to transition to EMRs and lessen the risk of facing the challenges. And EMR is the way to go. So what is EMR? EMR, by definition, it's electronic medical records. It's the digital version of the paper charts in the clinician's office. It contains pertinent information about the patient. It includes medical and treatment history, lab test results, and many others. EMR doesn't just digitize the paper, but it really helps our healthcare physicians manage their overall practice, from record keeping to inventory reports and ready-to-print form. More and more healthcare professionals are adapting to the use of EMR because of the many benefits it can provide. Number one, it's scalable data storage. You are not anymore limited to the cabinet space, but you can have as much records as you can. It also saves up clinic space. You don't need any cabinet anymore. Accessible anywhere and anytime, especially if your EMR is cloud-based, then you can just access it anywhere depending on the gadget that you are using. It is also time savings. You can look at the patient history within seconds. It reduces medical errors, optimize workflow. When there is less time to look for the patient history, then you and your medical secretaries can do more important things. And of course, patient data is more secure. Overall, the EMR really provides better patient care. Okay, so I understand what you're thinking right now. EMRs are good, they are beneficial, but do you really need it? Okay, so I have some guide questions for you. If you answer yes to any of these questions, then I think you need to switch to EMR right now. Okay, number one question. Look around your clinic. Do you have overflowing patient records? For example, you don't have enough chairs for your patients because instead of your patient sitting down the bench, ang mga paper records na ang naglingkod because nag-awas na gyud ato ang paper records. Is that the case for you? Also, do you have multi-clinic locations? Perhaps 1 to 2 secretaries? Sometimes our patients would miss our morning clinic that they want to go to the afternoon clinic operations. But how can this be possible if the patient record is in the morning clinic? So is that your case as well right now? Do you also have secretaries who will retire soon or resign or will be replaced? Sometimes our secretaries are the walking and talking patient records, that when they go, the patient records kind of goes with them, and when they are actually gone, you are lost and it takes some time for you to recover. So is this also the case for you? And lastly, are you relocating soon or planning of renovating your clinic? So when you are trying to relocate, you can start fresh by not bringing in your hundreds or even thousands of patient records when you don't even know if these patients will come back for a checkup, right? So try to reflect right now, though. And if any of these questions and your answer is yes, I think, Doc, EMR is the solution for you. So like any technology, EMRs have setback. You know, Doc, if you decide to really switch to EMR right now, you also need to really look at the full picture and understand that there are also setbacks as well. So number one, high cost to set up. There are server fees, at the same time, customization and updates. You also need to secure internet connection perhaps or even gadgets to use your EMR. Also takes time to learn a new tech. Any technology useful and beneficial would really allow like a 1 to 2 months learning curve to really know the step process of EMR. And lastly, you're reliant on electricity or the internet. Depending on the type of EMR that you're using, but more or less you will be needing a gadget that needs an electricity perhaps or needs connection to the internet. However, Doc, these setbacks can be managed and can be lessened by critically choosing the right EMR product that suit your needs. At the same time, choosing the right company. Also, if you have a backup data, cellular data, or a powered mobile device, then even if it's brown out or even if there is no internet connection, and you have a powered mobile device with a mobile data, then I think you can still continue with your consult. So there are a lot of EMRs available in the market today, but allow me to introduce our very own EMR Plus so that you would have a um, understanding of how it can also help you. Okay, so what is EMR Plus? EMR Plus is the MedEase brand of electronic medical record. It is a cloud-based web application that can be accessed anywhere with any gadget. As long as you're connected to the internet, then you can access your patient record. By the way, this is the interface of our EMR Plus. It is co-created by an internist, Dr. Rodette Arevalo from ERMOC. You're assured, doctor, that we created it for the doctor's use. And since we are now having more and more customers and clients using our EMR Plus, then we have updated and customized it for your everyday operation. Built-in security, so far we have 0 hacks, and it also helps that it's not searchable in Google. It's 99% up server time. It's accredited by the National Privacy Commissions. This is very important so that you are assured that your patient's records are secured and avoid breach. We also have available in IM systems, Pedia, and OB health systems. So since and I tell you that you need to be critical in choosing the right EMR Plus product and choosing the right company for you, these are the unique benefits as well for EMR Plus to help you decide. Number one, we have unique server per customer. When this is the case, bugs and issues are isolated so that your operations are undisrupted. At the same time, when you have a unique server, then you can also customize it to your needs. So our EMR Plus is fully customizable because we believe that each of our clients have specific challenges that needs appropriate solutions. And lastly, we have unparalleled after-sales customer service. Doctors, we will be with you hand in hand in this journey in providing better patient care with EMR Plus. We provide trainings whenever necessary, regular feedback, and checkups. So EMR Plus is accessible, reliable, convenient, and it's a customized EMR solution for all. And these our key features, which will be discussed in detail whenever you request for a demo. We have patient queuing and follow-up, unlimited patient records. It's easy to access patient history within seconds, even shown you in a graphical way. Vaccination and inventory, especially for our pediatricians who have vaccinations in the clinic. RX templates, you don't have to type in every time you have a diagnosis and a specific prescription. You can just click the template and it will be printed for you. RX pad and other printable forms and multi-user. This is very useful when you have multi-clinic locations and you have several secretaries. Each secretary will have a separate user login. So doctor, our EMR Plus is accessible, reliable, convenient, and it's a customized EMR solution for all. Now let's look at the doctors who have made the right move to switch from our PMRs to our EMR Plus. This is your very own colleague, Dr. L from Guadalupe. Dr. L is planning to renovate her clinic and clean up old paper medical records. However, if you look at the back, these are her patient records. They have several patient records, even dating way back in the 1970s, 1980s, because namana niya doc ang mga patients with as well sa iyang mother-in-law and even sa iyang husband. Now, they are planning to renovate, but every year, they really have a problem on how to handle the patient record. So one way to really declutter and renovate your clinic for that aesthetic feels is switching to EMR. So Dr. Al is now using our EMR Plus, and his feedback is so far so good. Though I have some changes to the system, I have fully adapted to the EMR. So are you like Dr. Al, who also is planning to renovate or relocate to a new building? Then EMR Plus is for you. Also, another feedback from a satisfied customer is Dr. A from Perpetual Super Hospital. In her case, she has actually 3 clinic locations, but good thing with Dr. A is she has one secretary only. Sometimes when her patients will miss the morning clinic, they go to the other clinic, and the secretary just remembers the patient information. But sometimes, since tao raman po ang secretary, makalimot yun siya. So good thing they have now transitioned, and it's very happy with the transition to EMR Plus. As her feedback, I am very happy with this transition. My secretary and I are still learning the process. So there is really a learning curve for our clients in transitioning to EMR. So that's it for our discussion for tonight. Do you have any questions? Please do feel free to ask me right now. Or if you need or considering to switch to EMR Plus, then book a demo with us. Please scan this QR code or email this address or even contact me. So again, Doc, and to our viewers, in summary, which is better, PMRs or EMR? It's actually case-to-case basis. But when you have situations such as I have mentioned a while ago that can be addressed and solved with an EMR, then please do transition to EMR and choose the right EMR for you with the right customizations. And MedEase has EMR Plus to help you out. Just book a demo with us and we will let you know more of our features.